Gastric issue, acidity and headaches. Is there a relationship between these two? What are the triggers for these gastric headaches? What changes can one make to prevent these gastric headaches? I see patients in my medical gastroenterology practice on a regular basis who complain that only when they're experiencing this gastric issue or acidity, they get these headaches. Is there any science behind this? Is there truth in this? Let us look into this in this video. There are several ways the acidity or acid reflux can trigger headaches. Acid reflux is a condition where there is either excess of stomach acid, and because of that there is a backflow of acid into the food pipe, or the valve control at the bottom of the food pipe is not functioning properly, allowing the free reflux of stomach acid. So when there is repetitive exposure of stomach acid into the food pipe, you get like this burning sensation in the chest or chest discomfort, and this can trigger muscle tension in the neck, sometimes in the arms and back of the head, and give what we call as tension type headaches. In some people, repeated acid exposure can also be linked to this sinus headache. So we often get patients coming from ear, nose and throat doctors saying that this patient has been having repetitive sinus problems, and could there be a relationship with the stomach acid? Frequent acidity can also trigger and sensitize the nerves in our digestive system. This repeated acidity can trigger the pain pathways in our brain and can cause what we call as migraine headaches. So these patients who have these migraine type headaches can feel quite nauseous or extremely sick and sometimes vomit. Either it just happens spontaneously, or sometimes they end up putting fingers to self-induce the vomiting so that they can feel better. Acidity or this gastroesophageal reflux can get worse in the night, and some patients are often disturbed because of this, and repetitive sleep deprivation can cause headaches and also worsen the migraine headaches. In somebody who gets frequent acidity and gastric symptoms, they might start to get more stressed and makes them more anxious. And we all know that stress and anxiety levels can bring on the headaches or worsen the migraine headaches. Not everyone who has acidity has headaches, but these symptoms can vary from person to person. What are the triggers for these gastric headaches? 5 C's. First one is caffeine, excess of coffee and tea. Secondly, carbonated drinks, various energy drinks. Thirdly, if you are consuming cheese regularly. Fourth, if you are indulging in chocolate frequently. And lastly, citric, so anything that is acidic, especially like lemon, oranges, pineapple, kiwi. Citric ones can increase the acidity and thereby can also trigger these gastric headaches. What changes can one make to prevent these gastric headaches? In terms of sleeping position, try and sleep on the left side, and also use an extra pillow to keep your head end a little bit elevated to minimize the chance of reflux. Sleeping for good 6 to 7 hours is important, and this can minimize the chances of getting these headaches frequently. If you are a smoker, you need to quit, and if you indulge in taking alcohol, keep it to occasional. Try and avoid eating late in the night, and especially having heavy foods. So if you do end up eating late, then you need to ensure that you are giving a gap of at least 2 to 2.5 hours before you hit the bed. Try and avoid eating masala rich or this kind of foods that has got a lot of spices, which can irritate the lining of the stomach and also can worsen the acidity symptoms. If you are overweight, try and lose that extra weight, which will help minimize the chances of reflux. Exercise is important, but if you are suffering with these gastric issues and acidity, try not to do high impact exercises or something that is too strenuous that can sometimes actually aggravate the reflux, especially too much of bending down or crunches. So low impact exercise is fine. Maintain a good hydration. Drinking enough and a good amount of water on a regular basis also keeps the stomach acid diluted. Try and manage stress levels, whether in the form of yoga, meditation, or whatever kind of relaxation therapy that you can feel will be useful, because this can reduce the chances of getting these headaches frequently.